Hello, I'm Lynn Doyle. Thank you for joining us here on Meet the Doctors, where each week we look at important health news, medical breakthroughs, and alternative therapies and how they may be impacting you and your family. Our aim is to explore the facts so that we can empower you to make educated decisions. Here's what we have coming up on the show today. You know, we baby boomers often feel under terrible stress in the role of caregiver to our elderly parents, who often suffer from forms of dementia. We can't be with them 24 hours a day, but we sure do worry about them all the time. Well, we're going to get the upshot on how our stress levels can actually raise our own risk of dementia and what we need to be doing about it.
So often it is the baby boomer generation that's coming in for a checkup, and we call them the worried well.
We'll also tackle how to prevent our loved ones from falling in the home. Often when elderly people fall, the outcome is bleak. And then later, a Harvard psychiatrist and the author of a new book called Outsmarting Anger will show you how to make peace with yourself and others with just a few simple steps. And it's not just to get us through the holidays either.
Be peaceful. It's remarkable. You know, when you are walking down a street and you see a stranger, you immediately attribute some intention to that stranger. Can I trust them or do I mistrust them?
Now for the news. There are new rules for those awaiting kidney transplants that went into effect this week. Young patients will now receive healthy kidneys from younger donors. This may actually help cut down on the need for retransplants. In addition, people will get credit for being on the kidney waiting list from the time they start dialysis, not from the time they get on that list. And patients will be able to get older donor kidneys as well. Demand for life-saving kidneys from deceased donors is far greater than the supply. Right now, there are about 16,000 kidney transplants that are being performed each year in the U.S., but more than 100,000 people are on the waiting list. And get this, the average wait is 36 months. Tragically, more than 4,400 people die while waiting. The American Cancer Society advises women under 65 against popping low-dose aspirin solely to ward off cancer, stroke, and heart disease. And a large new study says that low-dose aspirin increases the risk of major gastrointestinal bleeding that can land we women in the hospital. Aspirin boosted their risk of bleeding for women over 65 too, but the benefits outweighed the risk. The American Heart Association recommends that only people at very high risk of heart attack consider taking aspirin daily. Now, on a lighter note, do you remember Marilyn's sexy number from the 1953 hit Gentlemen Prefer Blondes?
A kiss on the hand may be quite continental, but diamonds are a girl's best friend.
Well, here's another gem from the iconic Hollywood bombshell. Marilyn once said, "Give a girl the right shoes and she can conquer the world," where science has finally caught up with what our girl Marilyn already knew. According to a French study published in the journal Archives of Sexual Behavior, if a woman drops a glove on the street while wearing heels, she is almost 50% more likely to have a man fetch it for her than if she's wearing flats. The study suggests that high heels are, quote, signifiers of femininity. I suppose that's why Carrie Bradshaw in Sex and the City went crazy for those Jimmy Choos and Manolo Blahnik stilettos.
They're supposed to be in here.
Manolo Blahnik, Mary Janes. I thought these were an urban shoe myth.
Well, for me, I'm ready to conquer the world. Obesity-related illnesses may shave up to 8 years off your life and lower quality of life for decades, a Canadian study shows. Even a modest reduction in weight of about 10 pounds and as little as 30 minutes of daily physical activity have been proven to reduce the risk of developing diabetes by as much as 60%. Now, for very obese men and women in their 20s, their years of living free from diabetes or heart disease were cut by about 19 years. So here's my question for you. What are you waiting for? It's a no-brainer. You have to get out there and exercise. It will save your life. And while we're on the topic of obesity, you know, we've had lots of doctors on this show who have warned us about the dangerous health consequences of being obese, which affects a whopping 79 million people here in the U.S. That's 1/3 of our population. Sometimes a dose of graphic reality can make a difference in order for us to break bad habits and to change our lifestyle for the better. In this case, it's the tragic story of Keith Martin, believed to be the world's heaviest man. We're joined now by our Newsmax Deputy Health Editor, Nick Tate, who's here to tell us about a man who weighed 1,000 pounds. Nick, it almost seems unfathomable.
Absolutely true, Lynn. I mean, Keith Martin was a 44-year-old Londoner who died of pneumonia after a long battle with obesity, and at his heaviest, he weighed nearly 1,000 pounds by some accounts. Now, while Martin was an extreme case, of course, his case really is a tragic and cautionary tale about the risks of obesity for all of us. His biggest goal in life was to do something that nearly all of us just simply take for granted, to be able to stand up on his own. Now, Martin's death came about 8 months after he underwent successful weight loss surgery to remove about 3/4 of his stomach. But despite the success of that procedure, Martin couldn't overcome his deep depression. He fell back into his old habits, eating up to about 20,000 calories of junk food every day. That's about 10 times what the average person consumes. And in the end, Martin seemed to simply give up, and his doctors were ultimately unable to save him, and he died of pneumonia. Now, Martin was clearly a special case, Lynn, but the take-home message here is that losing weight, even as little as 10% of your body weight, can boost both the quality and the quantity of your life, and that message may in fact be Keith Martin's legacy.
And it's an important one, Nick. We should also point out how important a role depression plays when people are fighting obesity. We really have to take that seriously as well, don't we?
Absolutely true. It's really a mind and body issue, no question.
All right. Nick, thank you for introducing us to him. We'll take a short break, but when we come back, we'll get the upshot on how our stress levels can actually be raising our own risk of dementia. We'll also tackle how to prevent our elderly loved ones from taking a fall in the home. And then later, we'll get a few lessons in anger management.
Keep on smiling. Oh, I said over easy! Now, why did I do that?
Because I refused to spoon with you last night?
Welcome back to Meet the Doctors. I'm Lynn Doyle. You know, if you are a baby boomer and you are caring for someone or know someone who is suffering from dementia or Alzheimer's disease, you definitely want to stay tuned for this segment because we have some very important information about your health. Dr. Jessica Swerling is a neurologist and the Associate Director of the Montefiore Einstein Center for the Aging Brain. She's been spearheading new research that helps baby boomers cope as caregivers with the failing memories of their elderly loved ones. She's here to tell us about it. It's nice to have you with us.
Thank you, Lynn, for having me.
Would you say that there are more people now caring for their parents who are suffering from dementia and Alzheimer's than perhaps ever before?
Especially with the baby boomers aging, we are a bit of a sandwich generation, and they are providing, from 2013 statistics, over 17.8 billion hours of care.
And when you say that, that's a startling number. That's care that's being provided in the home, not in a facility, not in a hospice center, not in a hospital.
Correct. That's care provided by the family.
And what kind of impact does that have on the caregiver to be responsible for your loved one, your elderly aging parent, as they are disappearing in front of our eyes?
It's so key to recognize. I often evaluate patients, and it's often that the caregiver is next to them and very stressed out. The caregiver is at risk for a heart attack, stroke. Sometimes they don't even have an established doctor. They don't follow up with the preventative care or the guidelines that we set forth by the medical association. So they're often neglected and often retreat and often have concomitant depression and are at risk for all of these other diseases.
And you actually witnessed this firsthand in your own family, did you not?
I did. My grandmother suffered from dementia for many years and was cared for in the home by my uncle. And my uncle actually passed away about 7 years prior to my grandmother passing away. So I really felt it from a personal perspective that it's so important to address these caregiver needs.
Well, you have our condolences on the loss of your uncle, but it also inspired you then to conduct this research to try to find out what kind of impact Alzheimer's and dementia is having on the caregiver.
Correct. Yeah, correct. I was very fortunate to have the Leslie R. Samuels and Fan Fox Foundation fund my research, and we have a care coordinator that's present, and we are now seeing the patients and their caregivers as a family. And whenever the patients come in, we say, "We welcome. We are treating you. We're treating your family." And there's just a sigh of relief from the caregiver that I'm at a place where actually people are focused on me as well as the diagnosis of my loved ones, and so it's been extremely important.
Can you give us some insight as to your findings at this point?
Sure. Actually, we've screened every patient for depression. We screen every patient for falls. We screen every patient for memory issues. And within the depression category, of over 100 people that we've already seen, we've actually seen over about 500 people with our care coordinator and our social worker. About 100 people, half of them have been diagnosed with moderate depression that previously had not been recognized.
What would you suggest then to people who are watching who are of that baby boom, that so-called sandwich generation, to try to either avoid becoming depressed or to be aware of the symptoms of it?
I think it's to recognize that this is a very difficult situation, that you're providing a service for your loved ones, and to not be so critical, but to recognize signs of depression, irritability, anger, frustration, withdrawal, all those interfering with their daily work. We actually have nice caregivers that we've brought in for some problem-solving treatment to treat their mild depression, and have helped them through social work and had their loved ones brought into the home with 24-hour care, and they've actually returned to work, which is wonderful. You
feel it's very important to send the message out that it's okay to put yourself first every once in a while. We all know that we love our parents, but sometimes as a caregiver, we have to put ourselves first.
Exactly. Not only that, putting yourself first is so important, because that actually helps with the outcome of your loved one, making sure that you're taken care of first beforehand.
One of the other things that you're also researching is the effect of falls on patients. There's also with dementia, but also just elderly patients in general. How prevalent are falls in America?
Falls are extremely prevalent, and actually the predictor for future falls is a previous fall. And actually what's not sometimes captured is the fear of falling. The fear of falling is actually a risk factor in itself for falls. So within our Center for the Aging Brain at Montefiore, we actually evaluate patients both cognitively, and they have a formal gait evaluation. So we're very careful in finding out what are different types of gait problems that may contribute to falls.
Can you give us some idea of who is more likely to experience that first-time fall, and maybe what we could do to prevent it?
Sure. Patients who are frail, who have an unintentional weight loss of about 10% per year, patients that have attentional problems or memory problems who may not be able to navigate the environment are at risk for falls. Patients who have judgment issues may not be able to judge certain risk areas. Patients who may have had a stroke, who are hemiparetic or weak on one side, may not be able to lift that leg properly. So it's so important to have a very thorough and detailed examination to help with identifying those risks.
And of course, if someone is suffering from early onset, these are warning signs. But what about just regular folks as they are aging? We're also in that danger category of taking a spill, breaking a hip. That's probably the thing that people are most fearful of.
Right. A healthy diet, vitamin D is important in that as well. Making sure that you're at risk for frailty, making sure that you go for your screenings, screenings for osteoporosis, healthy diet. We always say what's heart healthy is brain healthy too. So making sure that that's taken care of. And it does come up a lot. It comes up not only in falls, but in the cognitive realm. Am I going to become like my mother because I missed an appointment for her, or the worried well we often see. So often it is the baby boomer generation that's coming in for a checkup, and we call them the worried well.
I'm going to make a mental note of that. Do you think that these falls, as they become prevalent, keep people from perhaps trying things, or leads to immobility because they are a little nervous about falling around the house?
I definitely think so, and I think an in-home safety evaluation, making sure that there's a clear path to the bathroom. As we get older, especially in men, trips to the bathroom become more frequent, making sure that there's a well-lit area, that there's no rugs for tripping. You can have a gait evaluation. If there's any weakness, we can actually treat that and get a gait specified program with strengthening in the legs to kind of prevent that.
It's somewhat of a slippery slope, isn't it? You know, you're afraid that you might fall, and so you don't move around as much, and then you become sedentary, and then you gain weight, and then you have other risk factors. I mean, so we really need to be aware of this. This is a very serious problem.
It is, and it's an under-recognized problem, and it is a cascade of events, and that recognition of that fear and that treatment and the understanding understanding of that fear at first is just really important.
And if you had one piece of advice to leave our viewers with about caring for elderly patients, what might it be?
It would be to take care of yourself first. If you have questions about your loved one who you're worried about their memory, bring them in for an evaluation. We have a team approach at the Einstein Center for the Aging Brain and Montefiore Center. We bring them in, they're seen by a geriatrician patients, and we actually look at medications, we look at risk for falls, we look at actually address capacity. Can you make that decision? Is mom or dad at the point where they're able to make that decision?
Well, you know what? This is all very valuable information, and the research that you're doing is amazing. Thank you so much on behalf of all the baby boomers who are taking care of their aging parents.
Oh, thank you very much.
Wonderful to have you with us. We'll take a short break, but when we come back, nothing leads to anger more than being stressed out about something. So what do we do about controlling that rage? Well, when we come back, our next guest will help us manage our anger. Stay with us. We are back. Now let me ask you this. Have you ever experienced an explosion of anger? Has it caused you to hurt people that you love? Has it jeopardized a professional relationship? Do you ever feel like maybe your anger is out of control? Well, joining us in this segment is Dr. Joseph Schran, who is a psychiatrist at Harvard Medical School. He is an award-winning book author, and it's called Outsmarting Anger. It's been called an emotional survival kit. And we're going to hear from him in just a moment. He's going to give us some great advice on how we can deal with our anger. But first, let's return to Nick Tate for more information about Dr. Schran and his work with anger management.
Hey, Lynn, how are you?
Good.
Joseph Schran went from being a child actor on the Boston-based PBS series Zoom to becoming a renowned Harvard psychiatrist, which may make him uniquely qualified to talk about the range of human emotions. Well, his new book, Outsmarting Anger, as you say, really singles out anger as our most dangerous emotion, and it's really hard to argue the point. Lots of medical research has found that people who shout and yell and rage are more likely to suffer heart problems. Scientists don't really know why, but anger and hostility do activate the so-called fight or flight response, and that in turn boosts levels of stress hormones like adrenaline and cortisol that speed up your heart rate and increase your blood pressure. Now, of course, everyone feels anger from time to time. It's like stress or fear. They're normal human emotions that we all experience as part of modern day life. But the question is, how will you manage it when anger arises in your life, as it inevitably will? The answer really could determine how susceptible you are to heart disease and other health problems, Lynn.
All right, Nick, let's get to the heart of this problem then and talk with Dr. Schran himself. He's joining us now. It's great to have you with us.
Thank you so much.
Is anger an emotion that is normal in most people?
Absolutely. I think it's normal in everyone. It's a survival emotion. Anger is the fight branch of fight-flight, like we just heard about. So we get angry when we think somebody is imposing on us. Anger, if you really think about it, is an emotion designed to change the behavior of somebody else. We get angry when we want somebody to do something different, start doing something or stop doing something.
So why is it that some people seem to be angrier than others?
I think because they want things to change more. They really do. Anger is this overwhelming experience that we can have, and it stems from this ancient part of our brain called the limbic system, where we perceive that there's some danger and we want to approach it to get it to run away. We actually want to use anger to elicit the flight branch in somebody else, to get them to fear us and run away.
So explain to me how, if I'm standing in a line trying to buy a holiday present, and the person in front of me is angry at the salesperson, how that applies to your theory.
The 7 steps that I outline in Outsmarting Anger will really help you understand that. So the first 3 steps are about your anger. Let me just go through it, not your anger,
not
Lynn,
my anger.
not your anger, but anger in general. The first R is recognize that you're angry. Recognize rage. So the first step is to recognize rage. The reason I want people to do that is recognition is a thinking function, whereas anger is a feeling. As soon as you begin to recognize you're angry, you're more in control of it. And when you recognize it, you realize, I want to see something different. So that person in front of me who is angry in that line, what do they want to see different? They want something to change.
They want things to move along. They want to get to their next point of business. They want to get home. They have a child who's with them who's screaming, and that's irritating them.
Yeah.
These are all normal things that happen. I think recognizing it's great, but then what do I do about it? I'm standing in line and I recognize that I'm really ticked off. Now what?
So the next step is you've got to figure out why. Are you envious or suspicious? So envision envy. If you're standing in that line, you may be thinking, that person in front of me should be moving faster. I envy their position. Or I'm suspicious that they're trying to delay me. And it sounds sort of simple, but it really is, because we are complicated human beings with simple, ancient brains.
Would I be rude if I said it also sounded a little paranoid?
No, because that's part of the suspicion, right? We get suspicious. We get envious if we think somebody has more than us. We get suspicious if we think they're trying to take something from us. But now we get to the next steps.
Which are?
Well, if you think about it, if I'm doing this with anger, everyone's doing it. We all basically have the same brain. So outsmarting anger is not just about how I can manage my anger, it's how I can manage somebody else's.
But it's more important that we feel it on the inside, not just pretend on the outside.
That's right. And when you begin to really use this technique, you've recognized rage, you've envisioned envy and sense suspicion, you're projecting peace, you do the next step, which is engage empathy. Human beings want to feel valued by other human beings. That's really what we want. And empathy is a way of sending a message, I'm interested in you. When people feel you're interested in them, they go, well, that's really kind of nice. I mean, you've been at a party, right? You go to a party and there are people chatting and schmoozing. The people that you want to be with are the people who are interested in you.
Okay, good party advice, but how about a practical exercise that applies to our eyes? What can we do to actually try to train our brain to look at the world and view the world differently?
I want you to try this. It's about perspective. So if you in the audience who are watching, do the same thing here.
Okay.
Close your left eye, just your left eye.
Okay.
And now open it and close your right eye.
Okay.
And just go back and forth like that, back and forth. Do you see how the thing you're looking at is just a little bit different? There's a slightly different perspective because your eyes have a different geography. They're located differently. Now multiply that by 7 billion. 7 billion perspectives in the world.
So how does that debunk anger? How does it take some of the emotion out of anger by sitting here and doing this? Besides the fact that I'm entertaining the audience.
Because now you do the 6th step. When you realize everyone has a perspective, you want to know what it is. How do you do that? We use the greatest tool that human beings have ever invented, and that's language. You communicate clearly. You say, look, I can see you're angry. I've engaged empathy. I'm peaceful. I'm interested in why you're angry.
So you want me to do this when I'm standing in line in front of the person who's angry?
You can do it at first. That's right. Absolutely.
They're also going to think I'm
can do it.
crazy.
But then they'll back away, maybe. You know,
Maybe give me
that's
my
one
space.
way, I guess, to diffuse it.
And finally, what is the 7th step?
The 7th step, you trade thanks. You show gratitude. Think about this. 90% of the time in our culture, when somebody says thank you, the other person says, you're welcome. Now that's interesting. That means I don't see you as a threat. I'm not envious. I'm not suspicious. You projected peace. You've engaged empathy. You've communicated. You've traded thanks. These are the 7 steps. And I know it's difficult, but just think what it spells. R-E-S-P-E-C-T. When is the last time you got angry at someone who was treating you with respect?
Well, on that note, let me thank you very much for telling us how we can outsmart anger. It was wonderful to have you with us.
You're welcome.
We'll take a short break, and when we come back, we'll be answering some of your questions, not just about anger, but about medical issues and health issues as well. So please stay with us. Meet the Doctors continues right after this. We're back here on Meet the Doctors. I'm Lynn Doyle. And you know, each week we put together a panel of experts who graciously try to answer some of your viewer email questions. We call it the Meet the Doctors part of Meet the Doctors. It's one of my favorites because I feel like I learn something each and every week, and I hope that you are learning as well. This week's panel includes Dr. Ed Goldberg, who is an internist and gastroenterologist in private practice in New York City. We're also joined once again by Dr. Jessica Zwirling, who, as we learned early in the show, is a neurologist and the Associate Director of the Montefiore Einstein Center for the Aging Brain. And also joining us once again is Dr. Gregory Solomon, who is an internist as well. It's nice to have you with us.
Thanks for having us.
So you guys are ready to answer some questions from our viewers?
Absolutely.
There seems to be a prevailing sense of concern about the approaching holidays from our viewers. Several have written in and said, you know, this is the time of the year when we're supposed to feel so good and be so happy, and yet they find themselves moody, depressed, uncomfortable with their weight, worried about aging parents. What advice might we give these folks?
I've heard it called the triple threat. Thanksgiving, Christmas, New Year's, and some people really look forward to it ending. I find often that just with the changing of the clocks, people will come in feeling lower mood, lower energy. It takes a little while to get used to it. It does pass. There's certainly lots of techniques that can be employed. I'm sure you guys would contribute to some of those, like exercise,
well, I think part of this is that people feel that they're supposed to be happy, they're supposed to be doing something. And I think just recognizing that a lot of us, you know, don't feel the way that perhaps the media tells us that we're supposed to can be very reassuring, that it's very natural to worry about family at this time of year, for example, as opposed to celebrating all the time.
And the commercials make it look like it all comes together so easily when in fact we really can be overwhelmed by stress. Add in that so many baby boomers are helping to take care of their aging parents, as we discussed earlier, and that's really a double whammy.
Right, and what happens is you fast forward and here's the festive meal, but no one looks at the 4 hours or 5 hours it took to get that family member to that meal and the expectations behind it. But it's so important because it gives you so much information. Is mom talking to you as much? Is the eye contact the same? What's going on with the dynamics of the family? So the festive meal becomes the stage for what's really going on an everyday basis. It's a nice snapshot into what's going on.
Okay, and of course we always suggest that people be careful about what they eat. They eat more than they normally do at this time of the year, and sometimes they eat foods that don't necessarily agree with them, and then that presents problems later on.
Sure, and then drinking is also an issue at this time of the year.
You notice I didn't mention that.
I thought someone
I didn't see that as a problem.
Yes, but keeping an eye on that is important too.
Yeah, and last thing, I really think stress is the norm this time of year. And you watch television, every holiday special, people look so happy and relaxed. It's just not the way it is.
Yeah, stress is the norm. Those are words you just don't want to hear. We just have to find a way to manage our stress.
Yeah.
That's advice that doctors every week give on this show. I hope that you're finding a way to do just that. Let's go back to some of your questions. This one says, my mother is 87 and she's just had a very bad diagnosis about her cancer. Can you explain to me what the difference is between hospice care and palliative care, and how do I choose between the two?
Hospice care and palliative care are not mutually exclusive. They're very similar. My understanding of it is that hospice care is limited to people who have a prognosis of life of 6 months or less. Palliative care is intended to provide comfort to people at any stage of a disease. I would add that I'm sorry to hear about the person's mom's diagnosis, but both opportunities afford a very good experience for people at that stage of the game.
Our next viewer says, I'm trying to be the primary caregiver for my dad who has dementia. What resources are available and where should I start?
I'm going to look to my left and I'm going to look to my right to these wonderful internists here, and it's really important to start with the primary care doctor, to recognize that there's a situation there, to work closely with the specialist to establish whether that there's capacity to make decisions, to paint out what the picture is going to be, and really be part of a multidisciplinary team. At our Center for the Aging Brain at Montefiore Einstein, we actually have a geriatrician on board with a neurologist, with a social worker, with a geriatric psychiatrist, and a rehab specialist to meet all the needs for the caregiver patient dyad.
You know, as an internist, it's very reassuring to know that there are these multidisciplinary teams available, because one person can't meet all the needs of someone at this stage of their life.
Okay. And now this one says, are there any medicines that cause high blood pressure, and is it the same as having hypertension?
Sure, so there are actually quite a few medicines that cause high blood pressure. And whether high blood pressure is caused by medication or something that you already have, the damage can be the same to the blood vessels, to the brain, to the heart, to the kidneys. Some common medications to keep in mind are pain relievers known as non-steroidal anti-inflammatory drugs. Things like Motrin, Advil, and Aleve can do this. Headache medications like Imitrex can do this. Weight loss medications like phentermine or Qsymia can raise your blood pressure. Common cold medicines that have decongestants in them can do it. Hormone replacement therapy for women, including estrogen and testosterone for men, as well as anti-inflammatory medicines like prednisone. All of these can raise blood pressure. And I think the most important thing to keep in mind is that when you see your doctor or you speak with a nurse, just always make sure you tell them all the medications that you're taking.
Now, you mentioned taking your blood pressure. I know people who literally have the cuff at home and they take it each and every day, and sometimes 2 or 3 times a day. Do you suggest that, or do you think that it actually puts things in our heads that don't necessarily need to be there?
I have to give a hats off to that very exhaustive list of medications. That was very beautifully done. Thank you. Yeah.
I think it depends on the patient, because I have some patients who will check their blood pressure and they get in this spiral. The blood pressure keeps going up because there's this anticipatory anxiety about what their blood pressure is going to be. So checking blood pressure,
I have a different take on that, which is when we check blood pressure in an office with a cuff, we're measuring the cuff pressure, not the blood pressure. There is a way to measure blood pressure. It's only done in critically ill patients who are in an ICU or during surgery, where you actually measure pressure with a wire placed into an artery. When you do that, you see that with every single beat of the heart, the blood pressure is different. And when somebody walks into a doctor's office, if they don't get a little squirt of adrenaline that raises their blood pressure, they're probably a little out of it. So I do think people taking their pressure at home regularly, like daily for a few weeks in a row, really, I start to see the pressures really come down after a while.
Outside the office setting, where there's not that white coat hypertension or apprehension in the office, but Lynn painted a picture of Thanksgiving at our house, but she forgot to include the flu shot that everybody's getting as well.
High blood pressure
we're going to talk about that.
Are the same thing.
Okay, high blood pressure, hypertension, the same. Okay, we have to take a short break, but when we come back, we do have questions about the flu, and we'll have other questions from you, our viewers, right after this. Stay with us. We are continuing our Meet the Doctors segment of Meet the Doctors with your email questions and our panel of doctors. You mentioned, Dr. Zorling, before we took that last break, about the flu shot that people are talking about. Is there a concern that there is a flu shot out there that's not effective this year?
Well, I think in each year there's a prediction of what is the appropriate flu vaccine. There is some antigenic shift or shifting of the viruses, but it's an important part of the preventative medicine to include the flu shot in the regimen.
So we do encourage people who are watching the show typically to get the flu shot.
100%.
Yeah. Absolutely. So even on years when it's not a good match, there is some degree of protection.
Okay, you heard it here, folks. So here's a next question from one of our viewers. It says, my 18-year-old son is an athlete who's decided he wants to become a vegetarian. Is that a problem since he plays high school sports? Are there any nutritional issues that we need to be aware of?
Yeah, absolutely. I mean, I'm a big fan of vegetarian diets, but when you're an 18-year-old athlete, there are certain things you have to keep in mind. So you have to make sure that you're getting enough protein and energy-rich foods. And if you're a vegetarian, you're going to want to focus on eggs, dairy, soy, beans, avocados as sources of protein, peanut butter, cashew spread, that sort of thing. But also to keep in mind, particularly for girls who are athletes, is iron. They're menstruating, they can lose iron, and if you're not eating meat, you have to get it from whole grains, green leafy vegetables, dried fruits. Enriched healthy cereals will have iron in it. 2 other quick points. Dairy foods will provide you calcium and vitamin D. And then finally, if you're a vegan and you're not eating any animal products, it's critical that you do take a vitamin B12 supplement every day.
You know, I think it's 8 consecutive weeks on this show that we've mentioned vitamins and vitamin D3 particularly. And I have to say, since I first started to talk to you guys, that I now am taking it, have added it to my regimen. I know people are listening very closely to everything that you have to say. Our next question is, my mom has been diagnosed with stage 2 Alzheimer's disease. What can I do to help prevent her memory from getting worse?
Brings upon a point of a heart-healthy diet. So the stage 2 Alzheimer's disease is when you have memory complaints or you fit in the category of mild cognitive impairment. So you have complaints about your memory, but you're really functioning independently. So it's important to get an evaluation, to look at memory, to look at attention, to actually have an early driving discussion, because as mild cognitive impairment can be a precursor to Alzheimer's disease. So early driving discussion and assessing with memory testing is important, and walking testing as well, and assessment of falls.
Why is the walking assessment so important?
People with cognitive impairment are at risk for falls. It's an independent risk factor, so it's really important to screen both.
This one says, I passed a kidney stone a few months ago and my doctor recommended that I cut back on dairy products because of the calcium to keep from getting another one. I also read that I should eat less protein, and we just talked about eating more, but my diet is a high protein, low carb diet. What do we suggest here?
So the take-home message is drink fluids, lots and lots of fluids. That's really the only proven way to prevent recurrent kidney stones. Otherwise, it's about eating a healthy diet. You want to keep your salt low, so you avoid processed and packaged foods. You want to keep your potassium up, so you eat green leafy vegetables and lots of fruits. You want to avoid artificial sweeteners or sweeteners like sucrose and fructose. And a moderate amount of protein would be appropriate, but you don't want to cut back on calcium. That doesn't decrease.
You suggest just talking to your primary care physician first. Okay. And how about this one? With the colder weather, I always seem to have a cold. I have the sniffles. It seems like I always have a runny nose. Is it possible that cold weather is to blame, or am I allergic to the cold? I don't see anyone else who is sick all winter long.
That's a good one. And you know, it does hark back to being a little kid and having my mother say, if you don't put a hat on, you're going to go out and catch a cold. And then in medical school, they taught us that that's not true. But it actually is a little true. Because if your body is expending energy trying to stay warm while you're shivering, you're more susceptible to viral infections. To specifically address this, rapid changes in weather can definitely cause runny noses, and if this person is not seeing other people with similar symptoms, they have to get out more. The wintertime comes and we all get runny noses.
Don't you love the person who sneezes and then says, but it's not a cold. I don't have a cold. Like everybody wants to preface it with, oh, I have allergies, or it's the dry indoor air and that kind of thing. Sometimes you can take a look at them and know they're lying. They have a cold. Other times it probably is just some sort of reaction to the being inside all the time.
The funny thing, they teach us in medical school that proper sleep is very important. So if you accumulate this sleep death, you're at increased susceptibility to these winter viruses. So sleep is such an important aspect of health, general health.
I know if I look at him, he's going to say, well, your diet is going to contribute to your sleep patterns. Would you like to rail off a list of things we could eat that would help us sleep?
Green leafy vegetables.
But seriously, is there something that we could eat or that we should avoid eating that could impact our sleep patterns?
Oh, impact sleep as opposed to
sleep,
sniffles and colds?
Not the sniffles.
Well, sleep. Yeah, I think more about stimulants, and I think more about it's getting back to caffeine, and it's getting back to drinking alcohol. I mean, these things, caffeine obviously keeps us up for the obvious reasons. Alcohol, though, it makes us feel sleepy, disrupts actually our brain's ability to have normal sleep waves. And so though we're not sleeping well.
All right, and sleep, as we have learned, every episode of Meet the Doctors is so important in staying healty. Dr. Solomon, good to have you back with us.
My
Thank
pleasure.
you so much, Dr. Zwerling. I hope you'll come back again. Dr. Goldberg, I know you'd like to sit here. We'll see you here next week. Until the next time, we thank you for joining us here on Meet the Doctors. I'm Lynn Doyle. Stay happy and healthy.